PBS Utah presents the Governor's Monthly News Conference, an exchange between Utah reporters and Governor Spencer Cox.
Welcome, ladies and gentlemen. It's great to be with you again. It's good to see all of you. You're multiplying. It's nice to have so many of you here in studio, and for those of us, for those that are remote, we welcome you too. So I'm going to spend just a little bit of time starting off talking about where we are with the Delta surge of the coronavirus, and we'll talk a little bit about testing, and then share a little drought update, and then we'll open it up for questions. So some good news. Over the last 14 days, our positive tests are down about 20% in the state, and so there are good indicators that we have summited the peak of the Delta variant and are starting down the other side. That's welcome news, obviously for our hospitals and our frontline workers who have just been slammed over the past few weeks. The hospitalizations are starting to come down as well. That's a lagging indicator, and of course fatalities will follow. I want to talk a little bit about testing. Over the past several months, we have, of course, as this surge has happened, we've seen a significant increase in testing demand. Now, on June 1st, our Department of Health teams were conducting just over 7,400 tests. If you fast forward to September 21st, we conducted more than 19,000 tests on that day. This increase led to significant demand and unfortunately long waits at many of our sites. And quite frankly, we fell short of expectations in meeting this demand. Part of that change was that in the last wave, in the December and January waves of the virus, the other testing sites were doing a great deal of testing, specifically Intermountain. Intermountain was doing about half the testing in our state during the first couple waves of the pandemic. However, with the Delta variant, and because, as we've talked before, because of the lack of personnel that we have in our hospitals, specifically nurses, they had to pull their nurses from those sites into the hospitals, which meant that they couldn't test at the rate they were testing before. And so the state had to pick up that slack. And I'm pleased to report, I put that challenge to our Department of Health as we were, again, getting reports of wait times that were sometimes upwards of an hour or more. And I challenged them to make improvements to this process. And I want to report what has happened over the past month. We added staff to our testing team. So we added more than 238 new staff to the Department of Health and Test Utah teams. In June, we had 7 mobile test sites. Today, we have 16. We expanded locations and hours of operation. 12 additional sites were added over the course of the past month. Our community testing sites added 169 additional testing hours each week. And sites increased hours of operations, and others added additional days that they were open to meet these needs. We also made some operational changes, moving from an appointment model to a walk-up model helped to disperse the demand across all testing locations. And I'm pleased to report that the results have been encouraging. The last week, the longest wait time reported at these locations was 20 minutes. So and most were waiting less than 5 minutes. So we feel much better about where we are now with testing than where we are back then. I'm also pleased to report that next Monday, we will begin piloting a test-to-travel program. With the holidays approaching, we know that Utah residents are going to want to resume traveling. Many have already resumed traveling, and whether it's for leisure or to visit loved ones or for business, many locations across the globe are putting more and more testing restrictions on travelers. So even for vaccinated travelers, they're requiring tests usually within 72 hours, sometimes within within 24 hours. And we want to make it as easy as possible for Utahns who are traveling to get those tests before they leave, so that they don't get held up or stuck at airports or in their country of destination. So to help facilitate this, our testing site at the Cannon Health Building will have a dedicated testing lane specifically for travelers. This location will have rapid antigen, rapid PCR, and regular PCR available for travelers. These are the tests that are widely required by certain locations for traveler entry, and travelers will be responsible to know the type of test that is required where they are traveling. Our test sites can't be responsible to know what's required at every destination everywhere in the world. That's up to the traveler to know what kind of test that they need. These tests will be free to Utah residents and will be available for a fee to non-Utah residents. So people that travel from other countries to Utah that need a test to get back to wherever they're headed can go to this dedicated traveler lane and get a test, but they will have to pay for that test. Now, I want to be clear that travelers can still go to established sites throughout the state to get tested before traveling. Information on those locations is available at coronavirus.utah.gov. We're going to try this out. We're going to test it for a little while and evaluate the demand and effectiveness of this program over a 2-week period. And we may choose to expand this project into other areas of the state, depending on what we learn. So again, if the country will allow a rapid antigen test, we can have those results in 15 minutes for people. If they require a PCR test, which are the more accurate, we will have a prioritized rapid PCR test that will get that result back as soon as we possibly can in less than 24 hours, and then a regular PCR test that will take about 24 hours to process. So that's the plan for travelers, and again, that's at the Cannon Health Building here in Salt Lake. All of those locations will be available again at coronavirus.utah.gov. Another announcement, we talk about vaccines, we encourage vaccines. You will hear us always talk about the importance of the vaccine. It still remains the most effective way to protect yourself, to protect your family, to protect your community from getting the disease in the first place, and from hospitalization or death if you do get the disease. We have made some great strides here in Utah. Nearly 1.9 people now have received at least one dose of the vaccine. 75.2% of Utah adults have received at least one dose of the vaccine, but we still have far too many who have not received the vaccine. And we need our partners in the business community to help. We recognize all of those in the business community who are working to help get their employees vaccinated, to get customers and consumers vaccinated, and we're grateful for their efforts. I support and applaud them. And I'm happy to announce that PEHP, which is a public employee health plan, will soon be offering financial incentives to state employees and their family members to get vaccinated. So this is a forward-looking incentive for those that are not vaccinated yet. These incentives will include, by the way, these will begin. These are for state PHP employees. The incentives will include $100 for newly vaccinated individuals between the ages of 12 to 49. So that, again, $100 for newly vaccinated individuals between the ages of 12 to 49, $250 for newly vaccinated individuals that are 50 or over, and $50 for those who get a booster or are eligible to get a booster. These incentives, plus the administrative leave time that I have already approved, will hopefully provide an added push to have all of our 23,000 state employees and their loved ones vaccinated. And that new program will begin on October 1st. So we'll begin later this week. Now, finally, I would like to just talk a little bit about the drought before we open it up to questions, we have been the beneficiaries of some incredible monsoonal moisture over the past 2 months that has significantly increased the soil content, the moisture in our soil content. And I want to state that in June the moisture content in our soil was at the lowest in our recorded history, as low as we have ever recorded. And now, because of those rains, we're actually at average, which is huge. While that doesn't impact our reservoirs right now, it will impact our reservoirs next spring. That means when snow does come, it will actually flow into our reservoirs instead of going straight into the ground. That's what happened last year. Because we had drought conditions in the fall, we had very little snow, and what little snow we had, because of the moisture content was so low, it went straight into the ground. So this will certainly help us with spring runoff. The fact that we did have monsoons show up this year has helped. Again, it didn't do much to fill up our reservoirs that were falling quickly, but it helped reduce the wildfire risk and helped our lawns be a little greener towards the end of this. And that's where I really want to focus and thank Utahns. This is where we did make a difference. Because this was the worst drought year in our state's recorded history, we expected that our reservoir capacity would be at the lowest it's ever been. The good news is it's not the lowest it's ever been. It's close, but it's not the lowest it's ever been. We are below 50% statewide average, and the only reason that is the case is because people really listened and people helped and people used much less water. Billions and billions and billions of gallons were saved this year because people cut back on their watering and on waste. And that's made it possible so that if we do have drought conditions extending until next year, we will have drinking water available. That's really good news. Now, again, we're very hopeful that we won't have serious drought conditions heading into next year. But even if we have above average snowpack, it's going to take a few years to replenish the water that has been lost during this drought. So we still have a long ways to go, but I can tell you that we're all breathing a little bit easier now than we were just 2 months ago, and that's because people really sacrificed and made a difference. That being said, we are continuing to aggressively plan for a future where we do have less water and we have more people. We will be working closely with the legislature. We still have major issues, including those surrounding the Great Salt Lake, making sure that ecosystem can thrive and that we are getting water to the end of the row there. Obviously, there are concerns with the water that we share in the Colorado River Basin with the upper basin states and the lower basin states and the hydrology of that river, and those negotiations will continue into the future. But very likely that every state in that basin, and it's not just states, it's actually two countries. Mexico has water rights on that river as well. That we will all likely see decreases as we move forward and as those negotiations continue. And so it's incumbent on all of us to continue to find ways to conserve water and working closely to be able to store more water as well, working with our federal partners and our state and local partners who are involved in those decisions. And with that, we would love to open it up now for questions.
That designated travel test lane in the one test site in Salt Lake City, if those tests are available in sites throughout the state, why is making a designated lane important? Why is that something you're doing?
So the tests are available, but all of those tests aren't available in every testing location. So some test sites do have rapid antigen tests. Some states or some sites have the PCR test. The reason for this and what we're hearing, and maybe some of you have traveled and seen that, is it can be very confusing for the traveler to know which one they're supposed to get. These terms, PCR and antigen tests, these are terms that none of us knew anything about, a year and a half ago. And so that's been a struggle for people. It's also been a struggle for them to find a site that will be recognized by the country of origin. So even if they have the test you need, the country might not recognize that as a partner site. it. So one of the things we're going to try to do also is work with these countries to make sure that they will recognize our tests. And some of them have a partner where you have to go to a Walgreens, and maybe only one Walgreens here. We've heard of people who have had to go, who said that they could only find a testing site or a testing location. They've had to go to Las Vegas to get tested and then come back and get on an airplane. And so what we're trying to do is make it as easy as possible for people to travel, to have it all in one location that isn't far from the airport, so they can come here and get that done and get on their way as quickly as possible. And again, to make it free to people. There are sites that are requiring you to take a certain test. Travelers are having to pay $100 to $200 per ticket to do that, which means that people who aren't wealthy aren't going to be able to travel. And so we're going to try to ease that burden on travelers as much as possible.
Now, for domestic travelers, some states do require negative COVID test, or you have to show that you're fully vaccinated. Do you foresee Utah doing something similar to that for people coming into the state?
I don't foresee Utah doing something similar to that. I think that what we'll do is, as a nation, we'll make most of those decisions. Now, Hawaii and others are a little different, in a little different situation than that. But we do have requirements for travelers coming into the United States to have some of those tests. And that's why we also wanted to make this available for foreign travelers, so that they could take advantage of it, come and get a test to return to their country of origin.
Governor, the legislature has been considering whether to pursue legislation to block government vaccine mandates. You signed on to that letter, but some have also asked the legislature to block businesses from issuing vaccine mandates, a private company doing that. Where do you stand on that?
Yeah, thanks, Ben. We've been very clear on this. The Lieutenant Governor and I, you'll remember a couple months ago, we had a conversation with you all where we said that we support businesses in their decisions on whether or not to require vaccines, and I continue to do that. I know that position can be maddening to some, and that's fine. But I'm a huge believer in free markets, and a mandate not to allow businesses to have mandates is a mandate in and of itself, and it's government still telling businesses what they can and can't do, and I'm opposed to that. I think the businesses should be able to have a mandate. We know the Utah Jazz recently said that they're going to require either a test or a vaccine, and that's their right to do so, and we applaud the marketplace making those decisions.
So if the legislature pursues a bill and it gets to your desk, is it dead on arrival?
Yes.
All right.
What is the extra cost for incentivizing those vaccines for PEHP subscribers? And wouldn't it be easier to do something like Delta did, where they just raised premiums on those who did not get vaccinated? And where is the money coming from to pay for this?
Sure. So ultimately, PHP, I don't control PHP. I'm kind of making this announcement on behalf of them. And so I think that's something that a lot of businesses and employers will be looking at. What Delta did was they said, look, we've looked at the numbers. We know how much it costs to be hospitalized with COVID, and so we can do the math, and we can look at those ratios. Again, that's what they do best, right? They have people that are really good at math that can figure out what it's going to cost them. That's how insurance companies stay in business. And what they've said is we're going to raise premiums for those who are not. That's what Delta decided to do. We see that we've had things like that for years. If you smoke and you try to buy life insurance, you're going to pay a lot more for life insurance because your risks are so much higher. I suspect that we will see more of that from employers and insurance companies down the road. For now, they have decided that they want to use this approach to try to encourage more people to get vaccinated. As far as the cost, I don't have those in front of me, so I'm just working off of memory, Brian. But it depends on how many take advantage of it, right? And so they're not sure how many will take advantage of it. I think they said that their best estimate would be that it would cost about $3.9 million to fund this. and that they can use their reserves for this, but they believe, again, the demographers that are making these calculations, that the savings in hospitalizations will pay for it, so that the program itself will self-contain, will pay for it. I was talking to someone, I'm trying to remember. Oh, I think it was Workers' Compensation Fund who there were some. We were just having a conversation about what it costs for hospitalizations, and they had a few claims, some workers' comp claims that they had seen, there were I think three, and one of them was $500,000, and one of them was $1 million. That's how much it cost for a serious ICU intubated patient who was in the ICU for 30, 40 days, upwards of $1 million. I remember seeing some data that the average hospitalization for COVID this may be in the state of Utah, but it may have been nationally, was about $50,000. And so again, if for no other reason, if you're looking for if you don't believe in vaccines, or if for nothing else, there's a huge financial incentive to get vaccinated, to avoid those incredible hospital bills that people are paying who are not vaccinated and are in the hospital right now. So that's the theory behind this, is that it will pay for itself in reduced hospitalizations amongst those who are not vaccinated, which is also why they have a larger incentive for those who are older, just because of the rate of the mortality rate is higher with those.
Okay, we'd like
groups.
to go to a remote reporter. Sean with the Spectrum, go ahead with your question.
Hi, you mentioned the Colorado River Basin, and there was a shortage declared. And due to this shortage and the record lows at Lake Powell, certain advocates have been against the Lake Powell pipeline project from proceeding. So do you support the Lake Powell pipeline project, and kind of what's your opinion on that, especially with the West's drought conditions?
Sure. Yeah. So I've been very supportive of the Lake Powell pipeline and the importance of getting water, again, that belongs to the state of Utah to that area. Important to note that the way that works is that water comes from Flaming Gorge. That's where the water right actually is. Water comes from Flaming Gorge into Lake Powell, and then it's transferred through the pipeline to Washington County. That being said, everyone has to recognize the reality of where we are, and so those discussions are ongoing. Those discussions, even under the Trump administration, we were told that we had to work with our partner states to find ways to accommodate that project and others that we're looking at here in the state of Utah. Those discussions are happening right now, and they will continue. So we're very realistic. Our eyes are wide open about what the hydrology of the river looks like, and we're also working with those states on ways to improve the hydrology of the river. There are lots of things we can do. One of the unfortunate parts about what's happened is we have invasive species of plants and vegetation that have grown up along all of the tributaries that feed into that suck water out of that system. Of course, we have drier, we have less snowpack, the climate is warming. All of those things are impacting this, and so it's looking at, first of all, what is the reality of the hydrology, and second of all, what can we do to improve the hydrology of the river, and are there projects that we can work on together as states to benefit all of us? Because again, it hurts those upstream, it hurts those downstream. We're seeing that it's not just in Utah. Arizona farmers have had to cut back. California has the best deal in this, and even they're starting to feel it and having to cut back a little bit at the lower end of the scale. And not to mention the energy production. We're reaching levels right now in both Lake Powell and Lake Mead where we're not sure how low it can get and still be able to produce electricity, which is low-cost, cheap electricity that is used to power the grid. So those are very, very big concerns that we will be working on together. The Lake Powell pipeline is one piece of that, one small piece of that, but it is a piece of it. And so those conversations will continue going forward.
Quick question in studio.
Governor, what are your plans if the drought does continue next year and we have a similar situation that we had this year?
Yeah, so our plans are that we're working closely with the legislature. I think you'll see several bills coming out that are conservation-related bills, and making sure that we're doing more. I mentioned this. I spoke at the League of Cities and Towns yesterday, speaking to mayors and county commissions, and my plea to them was that we need every city to go back and look at their policies on the books. It's one thing not to require xeriscaping or low water use landscapes. It's another thing to make them illegal. And we have many communities where it's actually illegal to not put grass in, to have water-wise landscaping, which is just crazy to me. And so that can't happen. That's the first step. The second thing we're doing right now is we're working with farmers and ranchers. We have a program in place. It's a small program. We will be expanding it to help incentivize changes to much more water efficient crops and water systems. So replacing the old inefficient water systems with much better ones that produce a higher yield and use much less water. We have some pilot programs that are going on with Utah State and Southern Utah University where they have been testing out many of these different water-wise crops as well as water efficient mechanisms and pipe that will reduce the amount of water used. So that's the second piece of this. And then the third piece, Ben, is we are working very closely with private landowners and our water conservancy districts, as well as our federal partners on the high priority water storage projects in our state. So that means additional reservoirs for the growth that is coming and that we're anticipating in the future, and recharging aquifers. The great project down around Cedar City, where they have been working to recharge their aquifers over the past couple years. And we're seeing incredible results there, looking at water reuse and how we can use technology that's available today to reuse water in different ways to again, take advantage of the water that we have here.
Okay, that's all the time we have right now for our television broadcast. Join us back here next month for the Governor's Monthly News Conference. And I would like to introduce a special guest here in studio. We have Ethan Carboni from Judge Memorial High. He's here as part of our PBS NewsHour student reporting labs. So he would like to go ahead and ask you a question.
Hi.
Hey, Ethan, it's great to see you again.
Great to see you too again. So I think my biggest question for you is, how is Utah going to change the way that we create and the way that we use energy? Because right now we're trending towards even higher carbon emissions, and I know that President Biden has said that he wants to reduce the national average carbon emissions to net zero by 2050, I believe it was. So how is Utah going to help contribute to that goal, and what are we going to change?
Yeah, thank you, Ethan, for that great question, and thank you for being here. It's nice to have young people that care about these issues and that care about journalism. These guys are excited that there's a future in journalism for people like you. Look, this is important, and we too want to reduce carbon emissions here in the state of Utah. In my One Utah roadmap, we talk about accelerating that process and what we can do to help reduce for a couple reasons. One, as you already mentioned, that's important for the environment, right, and for climate change. Also, we have some air quality issues here in this state, right? We live in, especially here on the Wasatch Front, we live in this basin. We have inversions that impact us. We've certainly seen this summer a degradation in air quality that was caused by fires in other places, but greatly impacted the people here in the state of Utah. And specifically, though, your question was about energy and what we can do around energy. We're working very closely. Utah has one of the most rapidly growing renewable energy. I didn't state that right. As a state, we have one of the most rapidly growing sectors of renewable energy. So we are seeing huge solar projects, wind projects in the state. We have a huge geothermal project that we're working on with the federal government as well. nuclear is an important piece of this, and we have a nuclear project that we're working on right now. There was an announcement, although not in Utah, but right on our border, that Rocky Mountain Power is working with the federal government on a nuclear project in Wyoming that will likely be very close to Utah and potentially provide some of the energy here, again, clean energy to the state of Utah. All of those projects are really important. We are also working on technology to clean up the energy that we're using now. So to clean up the emissions that come from coal-fired power plants and natural gas plants and others, so that we can still have reliable energy and reduce the emissions that are happening there. It's critical for all of us to find and use the technology that is coming on board to reduce those emissions. And I feel very confident that over the next few years we're going to make great strides here in Utah. Thank you for that question. I saw another question up here before we quit.
Thank you, Governor. There's a recent report from UtahFoundation.org that says that Hispanics here in Utah tend to have poorer education. Therefore, there may be more limitations for better job opportunities and personal health decisions. For example, it is difficult for a farm worker to leave his or her workplace and go to a vaccine site. So what is your administration doing right now to improve these problems for this specific community?
Yeah, Veronica, thank you for that question. It's something that is really important to us. So one of the foundations of our roadmap was to make sure that we had opportunity for everyone in Utah, regardless of your zip code, regardless of your background. We want to make sure that kids in low-income neighborhoods, that kids from our multicultural communities, that kids in rural Utah have the same opportunities that kids in more urban and more affluent settings have right now. And that's a real focus. So we've been meeting with the legislature, working on some funding issues. I ran on this. It was part of my campaign. I believe that we have to make an even more serious effort to get additional funding to those schools and to those neighborhoods. Again, to make sure that there are the same opportunities. I can't guarantee those outcomes, but we should certainly be able to guarantee. In fact, I believe our Constitution requires that every kid in Utah have access to a high-quality education. So that's where we're starting. Specifically, though, around the pandemic, and you mentioned vaccines. We have a working group that came together early in the pandemic. We started to see, and every state started to see, that there were some real gaps in what was happening, specifically with our Latino community. They were testing positive at a far higher rate than the rest of the state. And what we realized was that we had some communications problems. It wasn't just enough to translate into Spanish or other languages. We actually had to understand and meet people where they were. It's unlikely that at 10 o'clock on a Thursday that they're going to be able to tune in and watch a press conference like this, right? So how can we make that information available? And the good news is we've made tremendous strides in being able to do that. But access to healthcare is also very important. And so I mentioned that we have these mobile clinics and that we've increased the mobile clinics. That's specifically to be able to reach out to those neighborhoods and to go to places where we have migrant workers, for example, who may be working in the fields, so that they can be there on a Sunday, which may be the only day where they can get vaccinated, or later in the evening when other vaccine sites or pharmacy may be closed, so that they have access to those resources. That's what we're trying to do, is engage more. And we have an incredible office. For the first time in our state's history, I was able to elevate to the senior staff level a person who's dedicated to these efforts, Nubia Pena, who is just an incredible human being and is working so closely to help us bridge some of these gaps. And I will say it's not just the Latino community. We have one of the largest Pacific Islander communities in the nation per capita. Our Native American community is another area that has really struggled through the pandemic, and with educational resources. We've been working closely with them. on some very basics. Some of you have noted and even written stories. The lieutenant governor is working closely with Westwater down in southern Utah, a place that doesn't have running water and electricity. Some of the things that we take for granted, right? That happens in places, and it's still shocking to know that that's happening in our state. And so a major push to make sure that we are looking out for our most vulnerable and those who sometimes don't feel like they have a seat at the table.
We have another remote reporter we would like to get to, Chris with St. George News. Chris,
we're going to get you up here sometime.
You know, one of these times we'll be up there, but it was great to see you down here a little while ago. So as far as another accessibility issue on the COVID front, monoclonal antibodies is known to be an important treatment for people who get COVID. Providers tell me about availability problems. And then patients will tell me about cost problems. In one case, there was a patient I talked to who was a breakthrough case. And what happened is they were told it would be $6,000 for them to get a monoclonal antibody treatment. So what can be done about the supply situation, and what can be done to make this affordable for people, especially breakthrough cases who did the right thing and got vaccinated?
Yeah, thanks, Chris. So very, very good question, and I appreciate that. There's been a lot written about monoclonal antibodies over the past several weeks. I want to make very clear that vaccines are still a far better way to avoid serious illness and death when it comes to this virus. But monoclonal antibodies are an important treatment. As far as availability goes, this isn't just a Utah issue. This is a national issue. With this surge that's happening again across the country, every state has ramped up their use of monoclonal antibodies, and so there is a limit right now on how much is being produced. There's a limit on how much is being sent to each state, and my understanding is right now the federal government has allocated that based on the hospitalization rate in every state. And while I know this sounds crazy, but I promise the math checks out. While our hospitals are full and we are, again, our frontline workers are struggling, even through the Delta variant, we have been in the bottom 15 for hospitalization rate per capita. I think we're probably 15 today. We've been as low as 10. We've been between about 10 and 15, again, 10 and 15 low states. So in the bottom 25% of hospitalizations in the country. The hospitalization rate nationwide is double what it's been here in Utah. And there are several states right now, West Virginia, Kentucky, Wyoming, where they are 3 times and even 4 times the hospitalization rate that we're seeing in Utah. And so what's happening is those monoclonal antibodies are being assigned based on that hospitalization rate, not based on just population. And so we're losing out on some of those. Now, so there's a couple of things that we have to do. We have to come up and again, very smart people, scientists, doctors have come up with a matrix to determine who gets those monoclonal antibodies, and it's based on the likelihood of hospitalization. And so it's a very invasive. It's a transfusion process that you have to go through. So it's a difficult, again, much harder than getting a quick shot at your local pharmacy. And so there's a lot that goes into that. Now, as far as the expense side, I'm assuming that if you get this, that it's your insurance that will cover this the way it would cover any other treatment at a hospital or a doctor's office. I'm not going to give you an answer that I'm not 100% positive about. And so, Chris, I'm going to have to follow up on that. I haven't had in-depth discussions about the cost. What I've been trying to do is make sure that we get as much and available so that we can prevent hospitalizations as much as possible. I will say, you brought up an important point, though. I know there's been a lot of hand-wringing, and for good reason, about unvaccinated individuals not getting the vaccine and relying on this. And I want to say, again, please don't, because we do have these limitations, and there's no guarantee that you'll be able to get it. But it's not just for unvaccinated. It is for breakthrough cases as well. Again, there is a matrix. It will be based on your likelihood of hospitalization. And so if you don't have many comorbidities, and we've covered this before, but if you're vaccinated, what we're seeing in hospitals, again, it's people that are fully vaccinated that end up in the hospital have comorbidities of 5 or more. So these are people who have lots of underlying health conditions or problems. So if you're fully vaccinated and you're a breakthrough case, you probably won't qualify unless you have additional comorbidities. Unfortunately, when we have a limited resource, we have to do the best we can mathematically to prevent hospitalizations, which is what we're trying to do. And so it's only those that are most likely to be hospitalized. But it's not just for the unvaccinated, it is for the vaccinated as well.
Okay, we only have about 5 minutes left, so I know in studio we had another question.
Quick question, Governor. I know that new FBI data, it's showing an increase in violent crime and homicides in Utah that's kind of at a 10-year high. Many factors, of course, that play at the local level, including understaffed police departments. I'm wondering if this is a concern for you and if there's big picture solutions at the state level that can be considered.
Yeah, thank you, Kelly. Great question, and it is one we're having conversations about. That report was just released this week that showed that nationwide, we are seeing a significant increase in homicides and violent crimes. Curiously, and the experts aren't sure why, we've actually seen a reduction in property crimes, and we've seen, I believe that rape was flat, and so we don't usually have a decoupling when it comes to that data. And of course, there are lots of theories about why that is and what may be causing it. Certainly, it is a concern for us here in Utah. I will note that our violent crimes like that have been trending down over the past 20 years significantly. And so we're nowhere near where, as a country, where we've been in the past, where we were in the 70s and 80s. But that doesn't matter. It's going the wrong direction. And so we are having conversations with public safety and others to try to see what we can do. Policing is a very important part of this. And I will say again, we've had some terrible experiences, terrible events that have happened. The murder of George Floyd being kind of at the forefront of this, that has caused us to pause and reevaluate. And caused our police departments to reevaluate how they police and how they work with our underrepresented communities. And I believe we've done a better job of that here in Utah, of reaching out. We had several bills that covered that. But it's also really hard to be a police officer right now. And as I talk to these officers and their families, they're just incredible people, public servants trying to do the right thing. And quite frankly, we have a shortage right now in every field. We have a shortage of bus drivers. We have a shortage of fast food workers. We have a shortage of engineers. We have a shortage of nurses. There is a labor shortage in our state and in our country, and that is especially acute when it comes to law enforcement. We have people that have been in law enforcement for a long time who have said it's just too hard. It's too divisive right now. I'm out, and we're having a hard time recruiting new recruits. Part of that is pay. We've got to pay them more, and there will be we'll be working on that with the legislature to make sure that we're paying our public safety more so that we can recruit more people. But what I will say is there is tremendous support in this state for law enforcement. We need you more than ever, and we're so grateful for your service. We need you to stay, and we're grateful for the way that you protect us and keep us safe. And we'll continue to look for ways to get that number headed back in the right direction.
Governor, what do you think about the effort to repeal and replace Utah's death penalty next year, and would you sign the bill if it came to your desk?
So I'm evaluating that right now, and I haven't made a final decision. We'll continue to work. I haven't even had honestly a chance to talk to the sponsors of that yet. That will happen as we get closer to the legislative session. I'll be very interested to see the details of that bill. I've been supportive of the death penalty in the past, but certainly I've had occasion to reevaluate my feelings about this. the death penalty. And I think that certainly any time we take a life, especially government taking a life, it's a very conservative thing to do to pause and make sure we always get that one right. I feel confident that in the state of Utah we've always gotten that one right, but I'm not confident that that across the country that has always been the case. And I've certainly been troubled by some of the cases that have been out there where there is some evidence or later evidence that maybe the wrong person was lost their life. That concerns me. I'm also will be very interested in talking to victims and their families. I think that's a critical piece of this conversation, and hearing from them. As I've had some conversations in the past, there seems to be a little bit of a change in sentiment amongst victims who, through the course of years and decades of appeals and having to relive that over and over and over again, that maybe that's not the best thing for them. And so all I can say is that I'm anxious to have this conversation and to listen to all sides, and then we'll make the right decision.
Okay, that is all the time we have, and thank you so much, Governor, for being here and answering all of our questions.
Thanks, everyone. Take care and stay safe out there.
Thank you, Governor.